So I think I don't have to tell anyone in this room that the United States is currently in the midst of an opioid epidemic. More than 700,000 drug overdose deaths occurred in 2017, and about 50,000 of those involved opioid drugs. We also estimate that there were more than 1 million non-fatal opioid drug overdoses that same year. And altogether, fatal and non-fatal opioid overdoses were associated with about $2 billion in annual hospital costs and more than $11 billion in expenses to the U.S. healthcare system. If we look at mortality rates by drug, for each drug, over the last 20 years, we see some interesting patterns. First, if you look at the blue curve, we see that death rates associated with prescription opioids have been steadily increasing for the past 20 years, with really no abatement and even a recent uptick over the last few years. We also see that illicit opioids, especially heroin, shown by the red curve, really weren't a contributing factor until well after 2010. So it's pretty recent. And we also see that another prescription opioid drug that's a very potent opioid drug called fentanyl really started contributing to mortality rates after about 2013. As of 2013, total costs to the U.S. in lost productivity, loss of lives, and medical expenses exceeded $78 billion. And within 2 years of fentanyl emerging on the scene as a major contributing factor to opioid overdoses, both illicit and prescription related, we see that costs to the U.S. exceeded $500 billion within 2 years. Fentanyl is particularly potent, and even getting small amounts of fentanyl can cause overdose. And it turns out fentanyl is contaminating illicit drug markets, including methamphetamine, cocaine, and heroin. And so if we look past 2013, we see that mortality rates for all drugs are really increasing, and it's mostly because of fentanyl. If we look at data for the past 40 years, we see that mortality rates due to drug overdoses have been increasing exponentially. So if we project that 20 years into the future, we see that within just about 5 years, drug overdose deaths will exceed 100,000 per year. And there will be more than 500,000 drug overdose deaths in the next decade. So this is a significant and rapidly growing problem. We need solutions to slow this epidemic. There are evidence-based strategies for preventing opioid overdose, including targeted naloxone distribution, medication-assisted treatments for opioid dependence. Naloxone is a major player in preventing opioid overdose. It's a drug that you administer to someone who is experiencing an opioid overdose to reverse that and to save their lives. But it does have a couple of barriers that limit its effectiveness. The first is that there needs to be a bystander that detects when a person is experiencing a drug overdose. And then that person needs to have access to naloxone so they can administer naloxone to the person who's overdosing to save their life. So I was thinking about solutions for how we could remove those barriers to help save a person's life when they're actually overdosing. And one obvious technology that came to mind to help with this problem are smartphones and wearables that nearly everyone in the United States has. So if we could leverage these mobile technologies to try to solve this problem, this could be very beneficial in helping to reduce the opioid epidemic. So a lot of people are interested in using mobile technology to solve this problem. And our goal is to develop a passive watcher that can be watching that drug user continuously and monitoring them and detecting when they might be overdosing, and then take actions to get naloxone to that person to help revive them. So, a lot of people are interested and developing solutions that try to tackle those two issues, the detecting the drug overdose and getting naloxone there. Although the majority do focus on just providing opioid addiction information and treatment provider information and so on, there are some apps that do crowdsource naloxone. So if there is a bystander who does detect that a person is overdosing on opioids and they have this app installed, they can use that app to crowdsource the nearest available dose of naloxone to be delivered there so that it can be administered to the drug user. There is at least one app out there that already focuses on detecting opioid overdose. But this requires the drug user to set a timer before they start using drugs, and then to stop that timer after they use drugs. And it's not clear how effective really either of those solutions are. They're not evidence-based, so we don't know how effective they are. But it does seem somewhat impractical to expect a drug user who's getting high to start a timer and then be able to stop that timer after they're high and possibly incapacitated from drug use. So we want to remove any kind of bystander or user interaction and develop a fully automated tool that can operate passively, not require any kind of active participation by other people. But to develop that automated tool, we need the right data. That's why this tool doesn't already exist, because we don't have the data to develop an automated tool for this purpose. So we need to collect data from sensors and smartphones in patients who have opioid dependence, who are using opioids in their daily lives. And if we collect these data and examine the temporal signatures, we can extract features that we can use to train machine learning models to develop prediction functions and classifiers of drug use behaviors that can then be deployed to take in new data and try to detect when that person may be using drugs or overdosing on opioids. So we have a clear path to developing an mHealth product for forecasting and detecting drug use and drug overdose that involves two phases. In the first phase, we have to get that data that we can use to develop our models. We need to collect data in the real world, and people are definitely working on this. They are collecting data, and there was a study that was published recently that showed that you can use this kind of sensor data to detect opioid use and drug overdose, but those data were collected in highly controlled environments. We need data collected in patients as they go about their daily lives to be able to develop these models. Once we have the data and the models, then we can architect, build, and validate a commercial product for forecasting and detecting drug use and overdose. Our team at McLean Hospital is uniquely positioned to be a partner in both phases. We have deep experience in addiction and addiction treatment and in conducting patient-oriented research. We also have access to patients. We have a lot of experience and infrastructure already in place for doing this kind of digital phenotyping in patients with psychiatric disorders, and we have technical expertise. Our ideal industry partner will have capital to be able to collect this data, possibly be developing specialized sensors and wearables that we could leverage to develop a commercial product. And I just want to conclude by saying that collecting the data is definitely the hard part, but whoever gets that data set first really has the goose that laid the golden egg in terms of being able to develop all kinds of digital solutions for prevention and treatment of addiction and drug overdose. People who have opioid dependence also frequently smoke cigarettes, use cannabis, drink alcohol, and this would be an incredibly rich data set for developing tools to address multiple kinds of addiction problems and to develop personalized treatment tools for addiction They can also be used to treat psychiatric disorders because people who have psychiatric disorders frequently have drug addiction. If you're interested in talking with me, I'll be out in the question area, and I'm also available by email. You can contact me if you have to head out for lunch and don't have time after this.